Good morning, everyone. On behalf of the Village Board, we thank you for being here today. In the 2019 strategic plan, the Village identified aging in place as a high priority. It has since been renamed Aging in Community and continues to be a high priority. In February of this year, the Village was recognized as an AARP livable community within its network of age-friendly states and communities. An age-friendly task force was formed in August, and the Village will be working on the development of a 3-year action plan to move Mount Prospect forward as a livable community for all, with a focus on our older adult population. Human Services and Community Development Department staff are members of the Metropolitan Mayor's Caucus Age-Friendly Collaborative and learned of a grant opportunity to further the Village's work on aging in community. Mount Prospect was recently selected as one of the 5 municipalities in the 2021 cohort in the Metropolitan Mayor's Caucus Aging in a Changing Region program. With support from the RRF Foundation for Aging, Mount Prospect is hosting 2 workshops led by Chicago-based Aging in Community specialist Brad Winnick of consulting firm Planning Aging. The workshops are intended to provide training, strategic guidance, and will be an opportunity to receive input and ideas from both our community stakeholders and Mount Prospect residents. Information and input obtained from these workshops will help identify priorities and specific action steps and strategies that support aging in community in Mount Prospect going forward. Thank you again for sharing your time and insight on this important initiative.
Thank you very much, Trust. Did I turn myself off? No, I'm still on? First order of business, are you comfortable and would it make it easier to understand me if I took the mask off? I won't be getting in any of your faces. Okay, thank you. Give me a moment. A lot of things happening around my ear. Well, that was one of the longest 30 seconds of my life. Okay. Well, thank you very much. I made in the presentation that I'll be kicking off going forward. So we've just had the welcome, and sitting in or on behalf of the mayor, we had Trustee Saccatelli. We're going to do introductions, and I'm going to call on my colleague Cheryl, who's got a handheld mic, to walk it around. I want everybody to know who all is here, in part because this is a whole of community effort, and I think that there is some specific value, and there'll be some value going forward that we get to know one another and maybe not totally recognize one another, since many of us have only half of our faces exposed. But what I'd like to do is I'd like to kind of have people introduce themselves with a couple of buckets. The task force members who are here, we'd like for you to introduce yourself. Maybe if you can, just raise your hands, and Cheryl's going to bring the mic around to you. So any members of the Mount Prospect Age-Friendly Task Force, if you could raise your hands, and Cheryl will, run around and get to all of you, and you can just introduce yourself and just name, and if you're representing an organization, that would be good.
I'm Christy Webb. I'm the pastor at St. Mark Lutheran Church.
Welcome, thank you.
I'm Emily Cadis. I'm an attorney at the law office of Kathleen Mearsman Murphy, and we practice elder law as well as guardianship and estate planning.
Great, thank you, welcome.
Good morning, my name is Ihan Kim, and I'm from Hano Family Alliance.
Good morning.
Good morning, my name is Jeanette Palmer. I'm the owner of a home care agency called Right at Home, and we provide caregivers for people in their home. So we're working with people in the community and aging all the time.
Thank you, Jeanette.
I'm Irma Rodriguez, resident.
Wonderful, thank you, Irma.
Hi, I'm Kathleen Mearsman Murphy, attorney here in Mount Prospect for over 40 years.
Good morning.
Hi, I'm Dallas Tomlin. I'm the Executive Director of Connections to Care, which is a nonprofit organization, and we provide seniors rides to their medical appointments, all handled by volunteers.
Thank you.
Good morning, Bill Gonzalez, resident, president of an HOA 55 and older community, and also a realtor.
Great. Thank you, Bill.
Andres Valencia from St. Paul Lutheran Church.
Great. Good morning.
Good morning. I'm Beth Corrigan Buchanan. I'm the Community Engagement Director at the Mount Prospect Public Library.
Great. Thank you.
Good morning. Chrissy Castillo, Director of Older Adult Services at the Kenneth Young Center. The Kenneth Young Center is a community-based organization that provides services to older adults in the community.
Thank you, Chrissy.
Good morning. I'm Mark Rice-Savvy with the Village of Mount Prospect. I'm the representative from the Building Department.
Great. Thank you.
Bruce Berry. I'm representing River Trails Park District.
Great. Thank you. So I think that looks like all of the hands for folks representing the task force. So now the second group I'd like to introduce yourselves would be the village stakeholders, elected officials, department heads, sister agencies. Some of you already may have introduced yourself as part of the task force, schools, libraries, park district, etc. So village stakeholders, including staff.
Hello, I'm Patty Ham. I'm with Public Works.
Morning, Patty.
Hello, I'm Terry Gens, Mount Prospect trustee.
Good morning, thank you.
Hi, I'm Ginny Thomas. I'm the Senior Services Social Worker for the Village of Mount Prospect.
Good morning, I'm Mark Bechtel with the Police Department. I'm an Elderly Service Officer.
Hi, I'm Valeria Tarka. I'm a planning intern at the Village of Mount Prospect.
Good morning. Edward Smirgelski. I'm a commander with the police department, day shift patrol.
Natalie Beckner, Assistant Village Manager. Good morning. Julie Kane, Director of Human Services for the Village of Mount Prospect.
I told Cheryl that she had to wear comfortable shoes today.
Antonio Lagos, I'm a development planner with the Planning Department.
Jill Heinking, I'm the public health nurse for the Village of Mount Prospect.
Good morning. Esther Salutillo, Deputy Director for the Village of Mount Prospect Human Services Department.
So I think that's it for the village stakeholders. The next group, this is like church or synagogue or something where people get introduced in groups, but it would be folks who are here representing any of the members of the Aging Network, the regional Aging Network organizations who provide things for older adults. I apologize on behalf of Age Options. I serve on their board and have done so for 10 years. The staff person who was going to be here had a last-minute conflict, and he couldn't make it, but he sends his regards and is very actively engaged with a number of the organizations here. So.
I am Cindy Gunderson. I'm the department director with Catholic Charities, and we're the counterpart to Kenneth Young. Mount Prospect is divided between townships, so we do Wheeling Township.
Wonderful. Thank you for being here.
Good morning. My name is Steve Samuelson. I'm here for the Frisbee Senior Center. We are a drop-in recreational and service center right on the border of Des Plaines and Mount Prospect, an independent 501c3 not-for-profit organization. And I'm also here on behalf of the local Rotary Club as well.
Thank you.
Hello, I'm Laura Lapp. I'm with Hands on Suburban Chicago, and I'm also, which sponsors AmeriCorps Seniors RSVP as well. We're a volunteer connector organization, and we recognize many of our community partners here.
Great, thank you. You're a couple more here.
Hi, I'm Christine Lawrence. I'm the new executive director at Mount Prospect Senior Living.
Thank you.
Good morning. I'm Corey Dewey. I'm the Director of Social Services with Elk Grove Township.
Oh, you can introduce yourself. You got here 45 minutes ago.
Good morning. My name is Jim Whittington. I'm with Lifeway Mobility. We are a home aging in place specialty remodeling company. I've been in business for 30 years, and we help people age in home.
Great. Thank you. Got one more. She was being.
Sorry, I should have handed it off.
Good morning, everybody. I'm Shelley Burrows. I'm the Director of Sales and Marketing at Mount Prospect Senior Living. We invite you all to visit us soon. Thank you.
Thank you. So I think that's all the hands I saw. The next bucket everybody may have introduced yourself already, but community stakeholders, community agencies, organizations, clubs, businesses, it's almost the none of the above category. So this might be your chance to introduce yourselves.
None of the above. Good morning. Ruth Ewell, the Director of Community Relations for the Mount Prospect Park District.
Oh, great. Thank you.
Hi, I'm Claudia Boyle from Van der Reels Medical. We've been working with the senior community of Mount Prospect since the 40s. So,
wow.
Hi, Robin Sandys, Northwest Housing Partnership. We run a senior handyman program and a capable program, which is an aging in place program for this entire region.
Robert, I didn't recognize only half of your face.
Hi, good morning. I'm Claudia Cook with AROSA. We do guardianship work. We act as healthcare power of attorney, caregiving services, and care management in all of the Chicago area.
Thanks, Claudia.
Good morning. I'm Sonia Ivanov. I'm the Executive Director of Northwest Campus. We are a non-for-profit agency serving anyone that experiences food and housing insecurity and homelessness.
Anna Klemkowitz, also with Northwest Compass.
Great. Thank you, Anna.
I'm Kathy Veller, and I'm representing District 214 Community Education.
Morning, Kathy.
I'm Sandra McLean. I'm here with Kenneth Young Center in a different division. I work at two places, Myers Place, which is in Mount Prospect, and also Phil Haven. We help people who are of advanced age, who may be experiencing mental illness as well, and chronic illnesses, and we help them try to live independently and not, access the hospitals as much. And so I'm a community support counselor and adult therapist.
Great.
Thanks.
Thank you.
Good morning. I'm Brian Mulcrone, and this year, having celebrated my 75th birthday, happy three-quarter century. I discovered I'm old, but I'm also representing the American Legion here today.
Happy birthday.
Hi, I'm Henry Sanchez. I'm with All Care Medical right across the street, and I'm also representing a home care service also across the street.
Thank you for being here.
Hi, Joe Gamboni from Friedrichs Funeral Home.
Good morning.
Hi, my name is Shawan Chung. I'm with MedTech Healthcare and Private Duty. We do in-home services as well as adult daycare services, one of which is one of the daycare centers, which is in Mount Prospect.
Great. Thank you for being here.
Good morning. I am Lynn O'Malley from Right at Home In-Home Care and Assistance. I'm the community liaison, and we provide caregiving services for individuals seeking to age at home in place.
Thank you.
Hi, I'm Maureen Centeno, Senior Services Specialist with Northwest Community Healthcare.
Great.
I'm Russ Bechtold, representing the Mount Prospect Interfaith Council.
Great. Thank you, Russ, and condolences on the Cubs.
I'm John Eilering, Market Chairman for Busey Bank here in Mount Prospect, and we provide money for the community if they need it. So.
Thank you. A few other hands. Anybody come in late who wants to introduce theirs?
Hi, I'm Dari Hartman. I work at St. Paul Lutheran Church, and we try to help whenever we can.
Thank you, Dari. So I'm thinking that pretty much covers the room. The only people you haven't met, I believe, are my colleagues. So Cheryl, do you want to introduce yourself? And Kyle next.
Hi, I'm Cheryl Scott. I'm the Sustainability Specialist with the Metropolitan Mayor's Caucus.
Hi, I'm Kyle Smith. I'm the Director of Housing and Community Development at the Metropolitan Mayor's Caucus and the staff liaison to the Age-Friendly Communities Collaborative, which is a body of about 50 municipal officials and staff focused on aging and community. We're very pleased to have partnered with Planning Aging, as well as the Chicago Metropolitan Agency for Planning, and funded by the RRF Foundation on Aging to provide this assistance. So very happy to be here.
Yeah. Great. I think that's it. Has anybody not had an opportunity to introduce themselves? Going once, going twice? Well, thank you very much. I hope you agree with me. You've got a fabulous room full of folks all invested in the community and on supporting aging and community. So that's perfect. You've already heard about the Aging in a Changing Region program between Trustee Saccatelli's comments and Kyle's. The only thing I wanted to add is we're working with very diverse communities throughout the entire region, the whole Chicago metropolitan region. So the cohort of municipalities you might be interested in include Mount Prospect, Bensonville, Calumet City, Hawthorne Woods, and Park Forest. And that's this year. Next year, we're going to be working with 5 other communities, also reflecting a tremendous diversity geographically, socioeconomically, community type, and frankly, how engaged they have been to date in efforts to support aging in community. So the only other thing I wanted to say, somebody asked me once we started having these conversations, so your program is aging in a changing region. What is that change to which you refer? And the answer was, well, our region is aging, of course, as are virtually all others, and really almost everybody around the country. But I know the name could be slightly confusing. What's changing about the region? So, okay, so we've had our opening matters, if you will. Next, I'm going to take you through a short presentation, and we're going to talk. I'm going to try to give you some context, background, kind of help explain a little bit more about aging in community as a concept, just to make sure that everybody's got kind of a similar grounding. Then we're going to talk about Mount Prospect in particular, and then we're going to talk a little bit about some of the assessments that many of you have filled out in advance of this morning's workshop. After that, I'm going to engage you in a discussion, kind of taking everything that we've talked about and maybe, trying to get some thoughts, some of your ideas, some of your input on potential future steps. And that's going to take us pretty much to the end of the meeting. We'll do a brief closing, and that's it. And we're going to try to get you out of here by the promised 11 o'clock hour. But if conversation's humming, I've got no plans. So, okay. So the main goals, what are the main goals? As I say, to provide some general educational background, and also very importantly, linking this conversation to the ongoing Village of Mount Prospect Age-Friendly Task Force that was already described to you. And to help, kind of build some support for this important work, our work immediately, the task force in an ongoing manner, as this conversation really goes from being a conversation that is now filling rooms like this, but the aspiration is that it becomes a true community-wide initiative. So I guess you haven't heard enough about me, so let me talk about me. So why am I out standing up in front of this room? Why am I in this line of work? Well, my background, I'm a lifelong Chicagoan, and I spent several decades as kind of your more typical city planning consultant, managing all sorts of projects, open space, strategic downtown plans, corridor plans, public and private sector clients. And about 10 years ago, as some of the important people in my life were starting to have some unique needs related to aging, I had an epiphany moment where it dawned on me that despite the fact I've been several decades planning major projects in the public sector, I knew nothing about planning for an aging community. And it dawned on me that that was where my interest lay. And at that point, I began to pivot. And 10 years ago, I decided to jump into the deep end of the pool. So I established my own small planning firm, which is Planning Aging. And as the name, I hope, suggests, really works at the intersection of community planning and the aging population. So for the last 10 years, I've been doing a lot of things: consulting, teaching, writing, doing advocacy work, and advising communities and other organizations about aging in community. So it really has been my focus, and I could not be happier that I made that decision 10 years ago. Okay, let's talk a little bit about aging in community. So the phrase aging in community sometimes needs a little bit of explanation. And how does it relate to some similar phrases? Because there's a lot of different kind of phrases out there, and how do they link, and are they consistent, or are they different? So aging in community, and this is my preferred term, is a general term, but it deals with a whole set of municipal commitments, strategies, programs, plans, projects, et cetera, all intended to support older adults within the community. And aging in community takes, therefore, a very broad community-wide view, using a broader lens than the kind of more individual dwelling-focused work of aging in place. The two work together. Aging in place is more micro, aging in community is somewhat more macro, if you will. And I say that a community's age friendliness, which is the name which is associated with the World Health Organization, now the WARP, or the AARP, WARP, it's like a radio station, AARP, age-friendly network of cities and communities, they use age-friendly, and I say that age-friendly can also be thought of as how well it supports aging in community. So in my mind, the two phrases are very compatible. So it can be confusing with all these kind of similar terms, but I say let's not let terminology confuse us. Let's keep our eyes focused, call it whatever works best and means the most to you and your community. So let's talk about aging in community and how it relates to being a community or a livable community for all ages. And again, I would say that there is more in common here, and they should certainly not be thought of as being competing for municipal attention or municipal resources. I like to think that how a community supports and helps its older adults meet their needs goes a long way to how well it supports aging in community. It's kind of obvious by the name. I also think that how well the community helps all of its residents meet their basic needs goes a long way to determining its overall livability or quality of life. So therefore, I'd like to try to instill in you the thought that how well a community supports aging in community is really a very key component of its overall quality of life or livability. I certainly want to try to plant the seed that aging in community should be seen as compatible with your other municipal priorities, initiatives, agendas, and not at loggerheads with. So there's not a tremendous amount of actual data or research on what older adults want in their community. But if you'll pardon me still referring to a 2014 survey as a recent one, the American Planning Association, which is a professional organization for community planners like myself, did a survey where they had kind of two groups working in parallel, but not together. And one group was the, quote, baby boomer generation. I'm not crazy about all these names and designations, but the older adult or ascending older adult population. And the other group was more the Gen X, some of the folks, some of, if you will, the younger folks in the room, my son, a younger cohort. And they asked each group the same question. And they asked them, what do they typically want? What do they look for in a community? And interestingly enough, the answers in the two groups were statistically identical. The older adults and the baby boomers all said they wanted the same things in their communities. And none of these specifically say older adult, younger adult. Everybody was interested and wanted appropriate, accessible, affordable places to live. They wanted to be able to get around easily and safely. They wanted places to go and to gather throughout their communities. They wanted access to various goods and services. They wanted to be able to be engaged and to feel engaged with their municipality and their community. And they wanted a government that listened and was responsive and supportive and provided good services. I thought it was interesting that what older adults wanted in the community pretty much was the same as what younger adults wanted in their communities. But let's be realistic here. Those of us who've had the good fortune to have, seen a few birthday candles get blown out over the course of our lives, older adults might need some things in addition to some of the basic things that I just articulated in that slide. Many adults may need a range of specific support services. And a number of the folks in the room, when they introduced themselves, gave you a sense of exactly those types of support services: healthcare, home repair, home modification, companionship, caregiving, various types of assistance. And that's what I refer to as what is typically, provided by the aging network. And my definition of the aging network is very expansive. It's public sector, it's private sector, it's faith-based, it's everybody working on behalf to support older adults. And the typical local aging network includes township, municipal, all of those folks, and many of them are here today, and you've met a number of them, and you'll be hearing from them. Let's talk a little bit about Mount Prospect. Here is, I promise you, the one and only slide which will have lots of numbers on it, and that's the smallest text. I apologize in advance. So this is taken from the CMAP, Chicago Metropolitan Agency for Planning, Community Data Snapshots. And if you can read it, it compares Mount Prospect by all these different age buckets and how they compare to the rest of Cook County and then the overall CMAP region. So I won't force you to try to do the math in your head and do all the additions, but for me, some of the key takeaways is, in fact, what is news to no one here is that Mount Prospect is aging, and that Mount Prospect is aging at slightly, but not significantly above Cook County and CMAP's aging rate. It's 65 and older population, including the 65 and the 74, 65 to 74, 75 to 84, 85 and over. All of those are aggregated into these figures. Oh, and by the way, for those of you who are desperately trying to photograph this and make sure you get it, good news for you. This is all going to be available through Mount Prospect's website, so don't don't scribble too many notes and don't worry about, am I holding my camera still enough? What's interesting also is that Mount Prospect, sometimes people ask when they're just getting their arms around the whole conversation of aging in community, they ask, is this not kind of a short-term phenomenon? We've heard about this older, this aging baby bucket cohort. Is this kind of statistically like the pig and the python? It's going to be a big number, but after that works its way through, it's going to be a smaller number? No. Look at the figures for Mount Prospect in the 35 to 49 and the 50 to 64 age cohorts. Mount Prospect has 41% of its population in those years, as compared to Cook County and CMAP's, slightly below that. So Mount Prospect is aging. Really, I think the takeaway is Mount Prospect is aging rather consistently with much of the rest of the region, and there's every reason to believe that Mount Prospect will continue to age at a reasonable rate consistent with the rest of the region. I am not a demographer or a statistician, but those are my key takeaways. Okay, I'm going to pivot a little bit. So let's talk a little bit about how aging in community has made it to this point today. There are a number of references to aging in community, and what I like to consider the guidance documents. So I'm a planner. I've written a lot of plans and certainly read and dealt with a lot of plans. And one of the things I did in preparation for this morning's conversation was read through a lot of the documents, the guidance documents for Mount Prospect. So the most recent comprehensive plan update that you all did, and I know many of you were involved in that, was about 4 years ago, Envision Mount Prospect, and it referenced and incorporated by reference a number of these plans. And I'd be remiss if I didn't say that Homes for a Changing Region is an effort that's Metropolitan Mayor's Caucus and CMAP and the Metropolitan Planning Council. So a number of these other, and I should also say that the Senior Housing Needs Assessment was prepared for the Northwest Suburban Housing Collaborative, which you've also heard from today and was done by a friend of mine. So a lot of these plans, including some areas specific, like there's a South Mount Prospect plan, they all were referenced in. So Envision kind of referred to them, gathered them, in a way kind of weaved them all together. So the Envision plan and all of these documents promoted a number of principles and actions that I believe are consistent with aging in community. So they reiterated and they spoke to and addressed the need for and tried to build support for a variety of affordable and accessible and appropriate housing, community neighborhood walkability and accessibility, a range of goods and services, including some specific older adult supportive ones, and then a kind of a more general support for important things: community health, safety, resiliency, economic vitality. These are all of the kind of the municipal priorities. It's links aging in community to some of those priorities. So while in my mind none of these, while these documents all generally promoted Mount Prospect as a livable community for all ages, none specifically really focused on taking this kind of whole of enterprise approach that I believe we're doing today towards aging in community. Now, as you heard from the trustee earlier, that the strategic plan is specifically focused on aging in community. And as she articulated, it started out in 2019 being a high priority in the policy agenda. The next year, it got rebranded Aging in Place to Aging in Community, which I think is perfectly appropriate. Aging in community includes aging in place, but not necessarily the opposite. And the most recent strategic plan identifies aging in community as high priority in the management agenda. So the time is here. So let's talk about Mount Prospect's journey towards aging in community. So as far as I'm aware, there have been early conversations in Mount Prospect as far back as 2016, 5 years ago. I know that because I was here 5 years ago, and I spoke to a large group of folks. It was mostly elected officials, department heads, probably a number of stakeholders. And what did we talk about? I was here to help Mount Prospect learn about aging in community and why it's important to Mount Prospect, and discuss how Mount Prospect might get on board and better support aging in community. Well, I don't believe that I'm burdened with too high-minded notion of my impact upon people, but I'd like to think that maybe a seed or two was planted 5 years ago that helped get us to where we are this morning. So some of the specific action steps that have happened over the last 5 years, as you heard, that Mount Prospect joined the Age-Friendly Communities Collaborative and also conducted some senior focus groups which helped confirm an interest in aging in the community, and talked about all of these very important themes here. In February of this year, keep this in front of me. Mount Prospect was accepted into the ARP Network of Age-Friendly Communities, as you've heard. This spring, Mount Prospect was selected as part of the Aging in a Changing Region cohort of communities, and you've heard that in August, Mount Prospect had its first task force meeting. So what I see here is I see increasing and accelerating action and activity and focus on aging in community. So we're in the right place at the right time. So I wanted to take a moment in my presentation just to make sure, to try to anticipate in advance any confusion or questions that any of you might have as to how the two workshops that we'll be doing today and one in the beginning of December, how do they link with the Mount Prospect Age-Friendly Task Force, which is ongoing, as you've heard. So these workshops, as we've stated, are about education and broadening support, and then getting ideas and getting input, and I'll be turning to that in a short while. So the workshop's results are specifically intended to help to assist the task force and the community as it becomes increasingly supportive of aging in community. And as one of the deliverables of the task force is to develop the age-friendly action plan, we're hoping that this conversation can help kind of kick off the work of the task force. And remember that the Age-Friendly Task Force is an ongoing effort, and like it or not, our time together will essentially likely end around the end of this year. That's when our Aging in a Changing Region program has us moving on and going to our 2022 cohort of communities. So just wanted to make sure that everybody understood the link between the ongoing task force and these shorter-term pair of workshops. Okay. So as I said a few moments ago, Julie and some of her colleagues helped make sure that everybody coming today was given the opportunity to do an assessment of how Mount Prospect is currently supporting aging in community. Came up with some very thoughtful questions. The thinking behind it is we're doing what I'm calling the 360 degrees of assessments, and that's to get assessments both from the internal stakeholders, public sector, aging network, the community that's here today, as well as the second workshop is really going to focus on community input and having a range of Mount Prospect residents give some thoughts and some feedback to get assessments from every possible angle to see where we are. So the task force, in conjunction with that, sent out a community survey, and I suspect many or most of you in the room have gotten that. Julie, I just wasn't totally certain, so I used kind of went out around September 7th, and the responses are due back, correct me if I'm wrong, kind of around November 5th. And so we'll be reviewing those results, the input from the community survey, and that'll help provide the context for the community conversation at workshop number 2. You'll also be able to provide input and assessments if you want to do internal assessments, if you don't recall if you received one or submitted one prior to this meeting. You can talk to Julie, talk to any of the folks here at Village Hall, and they'll be able to get you that so you can make sure that input is brought in. And we're going to review and analyze all of it, so all 360 degrees of input. So we reviewed these surveys, and between Julie and Ginny and maybe some other of you in the room, they kept periodically sending me increasingly large spreadsheets of all of the input. And they asked good, thoughtful questions, and they got good, thoughtful answers, which translate into really very full, spreadsheets. So we received, I believe, over 40 spreadsheets, and some of my key takeaways were, one is that Mount Prospect is extremely fortunate to have such a rich range of stakeholders who are all committed to aging in community and supporting older adults in the community. And that's you all here today and many others who couldn't be here with us this morning. But I have to say, I'm working simultaneously with 5 municipalities. So every municipality, the conversation, the workshops are slightly different. But in many of the municipalities, we've been doing similar, give an internal assessment. And so I've been able to do a little bit of reading of, what the Mount Prospect surveys come back saying compared to some of the other municipalities. And I won't name names. But one of the things I was very, kind of emotionally struck by the surveys and the assessments that I reviewed from your responses was that they all came from a place of compassion and empathy. I did not see anywhere in the surveys kind of the overriding sense of frustration or anger. Those older adults say this, or they want that, or they demand this. I didn't see that. I don't know what to attribute it to. I am one of the least expert people in kind of the, what makes Mount Prospect in the room today. So I leave that to you to perhaps think about, but it struck me. And I think that says only good things going forward. I was also struck by every response committed to continuing to provide support services to this growing older adult population. Nobody was throwing up their arms and saying, don't call on us, we're totally maxed out. They said, well, we're in for the long haul here. So that's all the good news. And as you probably anticipated, there was also what I saw as perhaps some of the bad news, some of the concerns that you all articulated in your surveys. And the themes are not going to surprise you, I'm rather confident. A lot of responses talked about a shortage of adequate, accessible transportation, appropriate, affordable housing, no surprise. I saw a good number of responses that addressed a lack of overall community awareness and some specific older adult awareness about all the various programs offered. A number of responses seem to say, boy, I wish there was a way that we could, more people could learn about us, we could coordinate information. I also saw a number of responses that addressed what I characterize as a misfit, a kind of a lack of fit, indicating that a number of the older adults who were interested in various services or programs did not have the technical abilities necessarily to complete, the application or to get the information. It's the whole, it's a kind of a catch-22. In order to get the information, you have to pull down the information, but if you don't know how to pull down the information, you can't get the information. So a number of responses addressed that concern. Also, a number of responses talked about language barriers, communication difficulties, knowing that Mount Prospect is a very diverse community with a lot of different languages being spoken by its residents. Obviously, translating and having, staff members or printed materials that work for people in their most comfortable languages is an issue and an ongoing one. I also had a number of responses, or we had a number of responses, that talked about volunteers. And there were kind of two flavors to the volunteer concerns, to be honest. One was a lack of volunteers. We're not getting the number of volunteers we've gotten in years past. So a shortage of volunteers was one of the references, or one of the themes. But another theme was difficulty in coordinating with volunteers. And it's probably a little bit related to this earlier bullet point about, community awareness of programs. Just a feeling like there wasn't a good coordination mechanism for volunteers who might be able to provide or augment some of the existing, services and programs. There were some facility issues, some physical issues, accessibility, meeting ADA standards, counter heights and things like that, accessibility to rooms, physical challenges, some of that, not a tremendous amount, but some of that. And then, of course, and you're probably saying, really? You put funding at the bottom of the list, Brad? Come on, that's everybody's, first concern is resources. But yes, everybody mentioned needing more money, knowing that they would be able to do more things if they had more funds, more staff, et cetera, et cetera. Okay, and the good news is, folks, start clearing your throats. This is when I'm getting ready to stop doing all of the talking, and I'm going to start asking questions, and then I'm going to be looking to you all to do the talking. And here's what I want to talk about. So many, but certainly not all, but many of the assessments I would characterize as being largely descriptive. You described what services are being provided, what is going on, what is the current level of support for aging in community. Rather than being, I'm not sure this is the best word, but I couldn't come up with a better one, so evaluative, making an appraisal. So most of the responses didn't give me a sense of, so what does the future look like? What is supporting aging in community in the future of Mount Prospect? What does that look like? So that's what I'm going to try to tease out with some questions in a moment. So let's analyze where it currently stands, and this is going to be your opportunity to identify any issues and opportunities to pay special attention to. And really, the folks in the room who are on the task force, this is where you should be scribbling notes as well. because these are going to be some of the things that will be ongoing conversation points moving forward. So let's have a little discussion. And the good news is, I'm not going to put questions on the wall for you to look at. I'm just going to ask questions. Cheryl is going to lace up her running shoes again, because now she's running around the room. But we're going to have simply a matter of, I'm going to ask you questions, and there's no order. I'm not, saying, municipal stakeholders or aging network folks. It's just going to be a free-for-all. So I'm just throwing questions out there for all of you. Okay? So, do you think that Mount Prospect currently adequately considers the concerns of older adults in setting its municipal priorities and making its municipal decisions? Are older adults adequately considered in municipal deliberations and decision-making? And nobody wants to be the first one to raise their hand, so who would like to make the second comment? Okay, the second comment is here. The first one I'm sure we'll pick up again later.
So one of the recurring things that I hear over and over again from people of advanced age, it's not just in Cook County, because I volunteered off and on for 20 years in nonprofit agencies, is isolation. When I studied at Rutgers University, I recently went back to school and graduated with my master's of social work. I was a 2020 graduate. So with Rutgers University, they did a study, I want to say it was 2016, but it might have been 2015, is that just speaking quickly about this, women tend to live longer than men, and they're usually alone. Men tend to generally, this is just generally, find a spouse, and then women are alone. So but both men and women live in isolation. And then with the isolation, like you were saying, a lot of those barriers happen. But one thing that I hear from people over and over again is it's a lack of trust. It's not literally like they see someone and say, well, I don't trust that program. It's they've been disappointed over and over and over again with maybe things in their life. And it could have been when they were older or when they were younger. So if they hear about, a service or a resource, they're not going to access it. Even though we might know, or I might know, as a therapist, wow, it's so good to have support because you have no one. They may rely heavily on just one paid support and not seek out peers because of a trust issue. And it could be something, again, with a program or an agency or something that happened to them before. So considering that, I think there is a great consideration because everyone's open in Mount Prospect. This is great. I've never been in a community where people do all of this and have all of these people invested. But the isolation component, I think, is the one to examine.
Okay.
Thank you.
Thank you. So your key point is that older adults are adequately considered, but issues of social isolation have not heretofore kind of made their way into the conversation. Julie?
I would just echo, I think that, with municipal priority, it's definitely always been important. Human Services started as a senior center and is now, a Human Services department, but still has a position dedicated to senior social work. But, as we all know in this room, it takes all of us to meet needs, and then there's still a lot of unmet needs. So while I think it is a priority, I think we need to keep focusing on it and identifying needs like isolation and addressing those.
Great. Thank you, Julie. And hands up if you wanted to add something else with, again, the question was kind of an overall consideration of whether you think that older adult needs, concerns are adequately incorporated into municipal decision-making and priority making.
So I work here for the village now, but I came
from the nonprofit world. I worked at Kenneth Young Center before for 12 years, and I kind of struggle because I think that, and I'm not talking about Mount Prospect, I worked with Elk Grove and Schaumburg Township, so that's a big area before I came here. And I struggle because I think there's a lot of things that municipalities don't necessarily know about the aging network. And I struggle because I think there's a lot of communication that could be happening in rooms like this. And luckily in Mount Prospect, we're taking that step, but I think a lot of the municipalities are not. And it's not because they don't want to, they just don't even have the awareness sometimes of what's out there. So I struggle. I think there's communication starting, but I think there's a lot to go from, and each municipality is in such a different spot. So I really give props to Mount Prospect for moving ahead with this.
I agree. Thanks, Jenny. More thoughts on this topic? Well, my next question actually,
I'm not sure if this fits in at this point, but
sure it does.
The social work staff that we have at the center, through a variety of different services that we offer, continuously gets feedback about affordable senior housing. And I know that's a topic that's addressed, but I forgot to mention in my introduction, I'm also a resident of Mount Prospect. So I think that there's a bit of a generational divide when we talk about affordable living in this community. And again, that's good, bad, or indifferent, but you have an older set that reacts adversely to taxes, and I know some of that is Cook County, and that's uncontrollable based on what's passed along. But when we talk about referendums from school districts or any local property taxes that end up getting raised, there seems to create this tension or resentment between the generations. And I'm not sure how to contextualize that, but I think, there's some sort of bridge work that maybe needs to be done to help both sides of that understand and better deal with some of those ever-changing issues.
Great point. And it will find its way throughout this conversation with, a number of the prompts that I'll be offering.
So one of the things that we constantly encounter with our company is people will say, well, why isn't there a waiver? Why isn't there some type of funding for me to get into my house or up and down the stairs? And I will tell that Jill was instrumental of a couple of years back when we had a client who moved into Mount Prospect, and they came through with $1,500 for 2 used stair lifts, which helped this lady's mom live in the community, which was immense. For them, it was good. But one of the things that come up constantly when we get into people's homes are, well, Medicare will pay for a wheelchair. Well, Medicare will pay for my pill, but how am I going to get in my house? They won't even pay for a little ramp. So there are, one of the things that I've done over the years with this company is I've always identified funding sources, whatever they might be, Habitat for Humanity, the VA, and villages. So right now on my hand, I can only name 4 villages that will provide up to $20,000 to keep a senior in their home. There's criteria, of course, but it would be really helpful if there was some type of waiver in Mount Prospect. And it can be, whatever it is. It can be like a $3,000 thing for a small ramp or a stair lift. Because like Mount Prospect, our showroom's in Arlington Heights. We have a lot of people. Seniors live in their homes since 1970, and most of the homes out here are split level or tri-level, and they don't want to move. So they want to stay in their home. And a stair lift costs $3,000. That's a lot sometimes on a fixed income. But if the village can maybe assist with that, I think that will give a lot of trust back to the village and also allow them to stay in their home.
And I would have been really surprised if Robin's hand didn't go up at some point soon.
Well, I just want to add on to that a little bit. Our organization, Northwest Housing Partnership, does provide home repair funds and home modification funds through IDA grants.
I've sent people your way.
Unfortunately, there are long waiting lists. They did just provide us additional funding for the next several years, and we are currently trying to get additional funding from private foundations to augment that so that we could have more funding for this purpose exactly. So funding is a huge issue, as was just mentioned, but we are a resource.
I know, I used to.
I think I wanted to follow up a little bit on Ginny's comment, and something you said is about communication. We have to remember that the seniors in this community, you talked about tech. I mean, the people that I work with, the average age is 86. If I want to communicate with them, I have to call them or I have to send them a letter. Sending an email, putting it on the internet, putting it on social media is just not an option, and that's expensive. It can, every time I mail, I have 400 passengers that so that costs me $200 every time I have to communicate with them something, or it's days of calling. So it's easy to send an email, it's easy to put it on the internet, but you're not reaching the people that you need to be reaching. You have to spend the money to be able to get out to them.
Good point. Thank you. So let me throw another question in at you, which all of these questions, they're going to be some, one's going to relate to others. Are there aspects of Mount Prospect that you perceive as currently most supportive of older adults? And then on the flip side, are there aspects that you perceive as being less supportive of older adults? And I'm sure many of you in the room are on the other end of the phone or the the inbox on your email of some of what the residents say about this exact sort of question. So aspects of Mount Prospect you feel are particularly well supportive of older adults currently, and aspects that are not at this point. And again, we'll start with the second response. So. Thanks, Jeanette.
I'll be the second response.
There you go.
So one of the areas that's lacking in Mount Prospect is transportation. And I guess affordable transportation that needs to be addressed.
Thank you.
I really applaud Mountain Prospect for having social workers like Ginny, and then having a police officer who understands elder care needs. I think that's huge, and not every city has something like that.
Great. So those are currently thumbs ups. Yeah. So.
Yeah, I want to say the same thing and add to that, because I've had interactions with first responders, and they've been really good. Sometimes when it's like I learned when I worked with kids, they can have a longer time to process information and respond, and they've been more patient. They're letting them, in comparison to other places with emergency responders that aren't maybe aware that sometimes people of advanced age need a longer time to process and respond. So they're not going to react as quickly as we would think or want them to, and so they're patient. So thank you.
There's chills on that. Excuse me.
As the public health nurse, I deal daily with residents in our community on their needs for caregiving. We have many caregiving agencies that work with us hand in hand and help us, but there's been a lot of change in the caregiving world since COVID hit. The number of hours that a caregiver can be in the home. Right now, currently, to get a caregiver to come to your house, you need to have them there for 3 to 4 hours a day, or you can't get a caregiving agency. You need to have them there more than 1 day a week, like usually 3 days a week, to get a caregiving private paid agency to come out and care for your loved one. That doesn't work for a lot of people in Mount Prospect who do not have the economic capability to pay for that. Caregiving services range roughly in the private sector from $25 to $30 per hour in our community. There are many people who just need someone to help them get up and someone to help them get to bed, and they can't afford more than that. It's a huge gap in service that's changed because of COVID. Prior to COVID, when more caregivers were available, where we didn't have the issue of disease and masking and vaccination, people had people coming into their home to provide those services on much shorter terms in ways they could afford. This is an industry issue, it's not an agency issue, and I think it's something we need to look at because there are a lot of seniors in our community that are going without care who desperately need it.
Jill, if I can follow up on that, do you perceive this as being a COVID-specific or of a temporary gap, or do you see that the pandemic has exposed some of the gaps and those gaps are systemic and they'll outlive the COVID shutdown circumstances?
A little bit of both. So as far as it being a COVID phenomenon, yes, that affects it. And if you look at what happened in the last pandemic that we had at the turn of the century, it took 10 years to come out from under that pandemic. It's going to take time to get out from under this pandemic. So in that regard, yes, there is a COVID piece to it. But in the sense of what's needed, there was pre-existing to COVID issues with this too, of families who would call me and just say, I need someone to check and make sure mom's breathing. I live in California. Could somebody just go open the curtains, turn the coffee pot on, and make sure she gets out of bed and is up? And then could somebody go do that at night to take her to sleep at night so I know she got to bed safely? When I worked in Colorado as a public health nurse, we actually had an agency that was called Sun Up, Sundown, and that's all they did. And it was young people, it was even high school students in some cases who on their way to school went and got a senior up. And then there's somebody else who came back at night and made sure that they got to bed. And there's little things like getting their garbage can out to the curb, which many of them can't do. There's a lot of small service bites, so to speak, that aren't being met in the community. So that I see going forward, continuing.
Great. Very helpful. Thank you, sir.
I have lots of opinions on all of this, so I probably will raise my hand a lot. So I will self-disclose that I'm 41 years old, and all of my friends and family laugh at me because I'm constantly talking about the house that I live in is not aging in place friendly and how I need to move out of my house, and my husband rolls his eyes at me. Mount Prospect, a lot of the phone calls that I get are from residents who own homes in Mount Prospect, live off Social Security and maybe a $100 pension a month, and they're looking to move out of their home. Some don't even own their home, but they're looking to stay in Mount Prospect in like a senior apartment building. And we just had one open up, Kenzie Senior Residences, and last I heard they only had like one apartment left, which is awesome that they filled it up. But we don't have enough housing in Mount Prospect for the seniors. They're constantly complaining to me about this, and it is not a Mount Prospect issue. It is everywhere. Because if they can't stay in Mount Prospect, they want to live 5 minutes from Mount Prospect. So Arlington, Des Plaines, Prospect Heights. And they don't have, housing either. So it's not just Mount Prospect, but that is the #1 complaint that I get, that people want to stay in Mount Prospect and they just don't have a place to move to.
Well, Ginny and I are friends for a number of years, and one of the things I like about Ginny, whenever Ginny says something, it makes me realize, that's right. That's a great segue to the next question. So I wanted to zoom in on housing. Several of you have touched upon housing. And essentially, I'll take Ginny's point and kind of flip it and ask it as a question. Do you feel that in general, Mount Prospect currently has an adequate range of housing options to well-serve its older adult residents? And by range, I say consider the totality of the housing stock in town, is that enough? Does it answer the questions Ginny has suggested that she gets a lot of input, that it doesn't answer the questions of where can I live and safely and adequately and appropriately and affordably live in whatever number of years you think of as when you're considering yourself as aging in community. So is there an adequate housing range of options? And if not, what do you think is missing that is most needed? Again, start with the second response to that question. Robin has the second response.
One thing that I know has been explored and talked about is the whole idea of home sharing or granny flat, various ways that people can home share. Whether it's middle-aged or people whose kids have moved out to college or whatever, and now they have extra space that maybe a senior could live in. Or there's a whole variety of things that I think could be looked at and promoted. There are a few national agencies that, for profit-making companies that do promote this kind of thing, but I think the community itself could look at this issue because it could be an affordable way to not only have a place to live in your community, but maybe also have people there to, watch out for somebody a little bit.
So home sharing options, different variations, flavors, approaches. Good, thanks, Rob.
To more specifically answer your question, I think the range is appropriate. I think to Ginny's point, the inventory and stock in certain areas is where the issue lies. Affordable senior housing where people can live independently is really, again, what we continuously hear over and over, and I think that there is a significant lack of that stock. And I apologize. To your point about the home sharing, there's an organization called the Center for Concern. Many of you may know of them. They were in Park Ridge. They now are in Des Plaines, but they do coordinate a home sharing program. And if you're looking for ways to maybe pick their brain on how to potentially do something like that, it would be worth outreach to them to talk about how their program is structured.
Great. Thank you. And John of Center of Concerns, a friend and an aging network resource. So part of the value of this conversation is identification of issues as well as potential, possible partners or collaborators as, solutions are being considered. I'm sorry, Jill, you've got it.
So I know Jim and Robin are here, and they're two of my greatest partners as far as helping seniors in town. But Mount Prospect was built in the 1940s and 50s as a baby shaker community. And all of the houses built here were built as baby shakers. They were not intended for seniors. I can't tell you, Ginny and I laugh hysterically. What tri-level do they live in is our response on every single call that we get. Because the seniors who are aging here have got a bedroom here, a bathroom here, and the garage where they get out down here, and nobody can get between those floors. I can't tell you how many stair lift calls, how many transportation helps that I do every single day for seniors in our community. What we really need is to find a way to have agencies like Jim's and Robin's and others to change, to rework, renovate the homes that we have. A lot of the seniors could stay in the homes they were in if they were more accessible. And we have an abundance of these homes that are built not senior friendly. That would be a huge, huge push forward in making our housing market more amenable to what we're trying to accomplish.
Great. Thank you. And Jill, I've got to say, I'll admit, I've never heard baby shaker community. That's fabulous. Oh, come on, hands up. Who's never heard that phrase before? Okay, so now you've all got one other takeaway from this meeting, and you'll always remember that Jill introduced you to it. So thank you, Jill. So,
I had a question. Well,
okay, and then right behind you, Cheryl.
Someone had brought up, the taxes.
Yeah.
And I have heard from, I don't know what you call it, like advocates, like people who are, their kids are grown. It's like, we're retired, we're on a fixed income. Why do we have to pay taxes? Because I think it's like 69 or 70% of our taxes in Illinois go to the schools. Well, if I don't have kids in school, so some communities, I'm not aware that anyone has done this yet, but I know some communities, I know Mundelein was one of them. I grew up in Mundelein. They were considering if people were, you would have to meet a criteria. If you were at this certain age, you're on a fixed income, then you wouldn't pay a percentage of your property taxes. But I don't know how that would work because the school needs the money. So I don't know if there's something at more of a macro level or advocacy level within, our state where, it'd be great if like legislators could come here, I think, and hear all the good work that we're all doing about funding, where, there's money being doled out, give it to us then and give it to the aging population then. That's just kind of my take on that.
Thank you. And I saw right behind.
When you mentioned the word takeaway, I need a clarification here. This gathering that we're part of today, as we go to the period between this meeting and the next meeting, are we going to see, for example, like a follow-up? Everything that we're adding to this, okay, is going to come back to us, okay? And I'm not sure who's accountable for this overall, okay? I'm not sure if it starts with Trustee Secatelli on the board. I'm not sure if you're the chair of the committee. But I think it's crucial because these are some wonderful ideas, okay, and some observations that I frankly never heard of. And as a consequence, I think it's of great value, and it's important. But the other thing that struck me as I came in for the first time today was the composite of this group here. I mean, there are people in public service and administration of the village, and there are people in the private sector who deal with the age. What's your term? AO, or is it OA?
Older adults.
Older. And it's a good collaboration because collaboration and cooperation is something which is intrinsically forever being missed these days in all sorts of endeavors. And so I commend all of you for being here with me. I'm learning so much, but I want to be able to take what I'm gathering up here to my groups and say, this is what we have to consider. This is what we have to deal with. And this is the opportunities we might have. So I don't know what the mechanic is going forward. Can someone explain that?
Julie, do you want to jump in as soon as we... Great observation, great questions, and we'll give you a couple of different pieces of feedback.
So just to clarify, the Village of Mount Prospect Human Services Department and Community Development Department are kind of collaboratively working on this initiative. And so we recently applied and were accepted to the AARP network of age-friendly states and communities. These grant workshops really complement kind of where we're headed as a village. And so a part of the network requires convening an age-friendly task force, which we kicked off in August. And so we're hoping that the feedback and input that comes from this, in addition to the resident survey, which we had copies of, and it's online as well, all of this feedback and data will help us in working with the task force to create a 3-year action plan. There will be working groups formed then to carry out this action plan, and we don't see this stopping in 3 years. So I think, one of the important pieces is going to be continuing dialogue with the community. Our hope today was that everyone leaves this workshop really thinking about aging in community and how it applies to what you're doing, but also that we connect and we can keep this work going collaboratively because none of us can do it independently. So I hope that answers your question a little bit.
And if I can augment that a little bit, some specific deliverables. So everything that we are doing, the Aging in a Changing Region program, these workshops under the grant that we reference, the village owns all of that. So, all of my presentation, that's, here and can be put up in the village website, as well as kind of the end deliverable at the end of our engagement together, not today, but after, subsequent to the second workshop, we'll be preparing a deliverable which will have some specific thoughts, ideas, recommendations, and that is intended to, as Julie said, kind of flow into what is already happening under the kind of the portal of the age-friendly task force. But I also wanted to kind of respond to something else you said, and it's a great subtlety in this conversation. You said something like, how can you take what you're hearing and learning about here to some of the groups with whom you're engaged? And I'd say that's part of the role of everybody here, is to be an ambassador, an emissary, so that you can kind of be the point person in your group or in your social network who may have an antenna up towards this broad community-wide aging and community ongoing conversation. You might be the link in, I don't know your organizations or your networks, but you may be the one that may be kind of reporting back to them, hey, here's what's going on, here's opportunities for us to, get involved or be engaged or respond or review, draft, proposals, et cetera. So that's part of you didn't realize when you were invited to this that you were like signing up to be an ambassador or an emissary on an ongoing basis. But that was implicit. I'm sure it was implicit in everything that was written in your invitation materials. So is that good answers? Or?
It's a good answer.
Oh, sorry.
The other part of it is this. As much as I'm curious about the findings, I'm also curious about my brethren. Okay? I mean, this is an incredible network.
Besides knowing what we are discovering amongst ourselves this morning, I'm hoping that I will know who I have been with. Yeah. You will know you got all the information. You have the who and the what and how to contact us. But I think there's probably a visible need for us to be able to know who is in this sector, okay, who is in community nursing, who is in social work, who is in the private sector, who does the reconstruction, or community organizations. That's invaluable because that's also part of that's an important part of the who in this data gathering that's going on. Thanks.
Completely agree, and that's why there was, very specific intentionality to making this a multi-sectoral gathering. And your point about having information, takeaways, names, contact, kind of listings, the form is yet to be determined, but I think that's a commitment. We'll be including that in some of our recommendations. I'm very confident that Julie and her colleagues will be making that available because that's an important value added for this discussion. So sorry to keep you waiting.
That's okay. I just wanted to go back. Several people have mentioned taxes. And I think when you think about age-friendly, you have to think about age-friendly is from growth all the way to seniors. And my experience, I had the luxury of growing up in a town in Michigan that was, at the time, the only school district in the history of the United States that shut down because we ran out of money. Like, I did not go to school in second grade for the entire month of October. We had no money. And when we opened again, we had no busing, and my school district is 600 square miles. We had no nothing. And you think, oh, I don't want to, why does 60% of my taxes go to funding? Well, yes, the school, but it impacted my community for a dozen years. We couldn't fund anything after that because we couldn't get doctors, we couldn't get the hospital, we couldn't get any kind of services. So it's hard, I know, when a senior says, well, I don't have any kids in school, but the impact of schools is going to impact the community itself. So you have to focus on, if you don't fund the schools, you don't get the people into the community, and you don't get the extra services, and you don't get the money that you need. Again, it took 10 years for my school district, and it actually almost happened again when I was a senior in high school, to the point where Michigan changed to sales tax, not property taxes. But it, you know what I mean? I think you have to realize that schools do impact the senior community, and being able to pull them in, pull those younger people in, will help the senior community ultimately.
Thank you. And I'll editorialize and say that that's kind of one of those rare instances where I look to the state of Michigan and say, boy, aren't they enlightened in some of their public policies. Illinois is still struggling from the burden of being property tax dominated in its educational financing. And so, anyway, please continue.
Yeah, regarding housing, thinking in the future, the idea of making sure the seniors are well equipped to deal with technology, making sure there's the internets in the home. I think that with given the caregiver shortage and all the isolation, making sure that they have simple technology to keep them connected, to make sure that they know how to use it, that they've got the internet connections in their home.
Great, thank you. And I saw a trustee had her hand up as well.
Thank you. I work for Lutheran Social Services of Illinois, and we have an In Touch program which goes into non-nursing care into the homes. But what we've been doing increasingly is becoming really good at case management. And we've been working with kind of a software app, which is expensive, called NowPow. But it basically, when you have a provider going into a home and you find out that the person needs this or the person needs that, it geographically will find, the right resource that our person can connect that client to. So, I mean, it sounds like our staff is already already doing a great job of case management, but, maybe something like that would solve the communication issues of, bringing together all the resources that we have and being able to communicate and provide those collaboratively.
Thank you, trustee. And I saw a couple of other hands in my periphery vision. Yes.
I was just going to comment on the taxes issue, just coming from a real estate attorney perspective. We do offer in Illinois the senior freeze. I don't know how many people are aware of it and how many thousands of dollars it can save people if they apply for it, because it is not automatic, but it is based on income. I believe it's $65,000 a year now. And if a senior can prove that they meet those qualifications, they actually get an enormous tax break. But again, I don't know how aware seniors are of this. I do know that various municipalities are very good at working with people and helping them apply. But if that's not common knowledge, that this is something that people can apply for, that's an issue.
Okay. Well, that's good, because that relates to one of the commonly heard concerns about just overall awareness. So
I just want to mention there's a senior freeze and then there's a senior exemption too. Yeah. Just the senior exemption itself saves about $1,000.
Yeah. So
you don't need income qualified for that.
So before we move on from what, if you recall, was actually a question about housing, specific housing types, I know we're all like allured by, venting our concerns and our frustration with tax issues. Any other last comments on adequacy of the existing housing inventory and any missing housing types that you want to just give some air to so that they're, mentioned in this conversation? Seeing no hands up, I'm going to pivot. Let's talk about another issue. Several people have talked about transportation. I want to break the transportation discussion, if I may, and I'm not sure it's appropriate, but please indulge me to kind of break it into two pieces. Vehicular and non-vehicular. Can older adults, in your estimation, get around Mount Prospect safely and accessibly using existing vehicular transportation options? And what modes of vehicular transportation do most of the older adults with whom you're familiar, what do they use to get around? Do they drive themselves? Do they rely on another private automobile? Do they utilize Connections to Care, another one of, the existing entities or organization? Do they take public transportation? How do older adults get around town when they need vehicular transportation to do so?
Excuse me. I can speak for the Park District. It's something, we discuss this issue all the time. I would say private vehicles, and the very unfortunate side of that is as soon as they lose that ability, even something as simple as a minor injury or a small surgery, we go from people who lap swim every day for years for the benefit of their health, and then they're just gone. I have never seen in our facilities public transportation utilized, even coming into our parking lots for that purpose. So as soon as they lose their ability to drive themselves, the most dedicated people for all the right reasons, they just disappear.
If I can ask a follow-up, if you've engaged any of these individuals in kind of a, hey, we've missed you sort of communication or a post-evaluation, have you ever asked them questions? I guess the question I would have is it by force of habit? They're accustomed to getting into their car and driving themselves, so once they can no longer do so safely, end of discussion? Or is it that they may not be aware that there are other options and services that would allow them to go to the park activity that they enjoy without, singularly relying on them driving themselves?
I would say, honestly, I think it is right now perhaps a little bit of both. I deal a lot with our senior population, and transportation and other issues. It's on their terms, and that's not a negative comment, but it's on their terms. So if I can't drive myself, then I don't feel safe, I don't feel comfortable, I don't know anyone, I'm not sure the bus route, and on and on and on. And it's not an excuse, it's just a decision. So unfortunately, probably the answer is it's their choice. It's a very sad situation for us. I just want to share a real life story very quickly. We open our facilities for free walking for seniors in the cold winter months. And many of our staff will get to know many of these people, and we do take very seriously the role we play in their lives. We specifically say to our staff, greet everyone by name. How was your day today? What else do you have planned to do today? And I have a situation where we have a full-time staffer who for 3 days a week now, for over 3 years, has gone to pick up a senior who, if you know our town, lives right across Central Road, less than a mile from our facility, so they can walk Monday, Wednesday, Friday, and then comes out of their office to drive them home. Born just out of the fact that they started a conversation and became friends. So it's a really lovely story from someone who will go nameless. But on the other hand, how sad is that? That they can't get here unless someone brings them that they trust. So there's so many issues. I've learned a lot from Jill and Ginny. We've talked before, but that transportation from a Park District perspective, I mean, the ideas for programming just come out of every part of all of the good work that we Park District people do. But if they can't come, they can't get there, there's not much point.
Thank you very much for feedback and the specific personal anecdote, which is very meaningful.
Elk Grove Township, we do provide free transportation for those that are disabled or 55 and older, but we don't cover all of Mount Prospect. We're south of Central and west of Mount Prospect Road, so north of Central Road would be Wheeling Township, and they have their own program. We can take seniors, to their doctor's appointments, dialysis, shopping, and all that within the township. But one restriction that we do have that hinders a lot of our seniors is if, let's say, they go to Jewel or Meijer or wherever they're going grocery shopping, they're going to have to get those groceries themselves, and then they're going to have to carry them into their home and load the refrigerator and all of that. And so, our drivers can't go in their house, and unfortunately, they'd love to, but we just have restrictions. So, if we could network with someone who a buddy could come along with them to do that, and we kind of suggest that, and to the seniors, do you have somebody? And they said, well, if I had somebody, they'd be driving me anyways. So, it's a great service, but those are some of the restrictions that that we deal with. And then I've had a couple seniors who they're having a hard time affording to drive. The gas is so expensive right now, the insurance and all of that, but they kind of show some embarrassment of taking the free public transportation, which is interesting. So kind of dealing with those barriers too.
Yeah. Thank you. Interesting. And the sort of programmatic restrictions based upon the funding stream, that's endemic in the transportation conversation at really every level. So
I'm the executive director of Connections to Care. So we work collaboratively with Elk Grove and Wheeling. The joy is we do cross township lines. The bad news is we don't take wheelchairs. There's pros and cons to we don't do grocery shopping, we only do medical appointments. My issue is I don't have enough volunteers. I could drive 100 seniors a day if I had enough volunteers, but I just can't do it. And once, we just had a new volunteer start, and it took her forever to take her first ride. She just got so nervous. Well, she took it, and she even called us and left a voicemail that said that was the best thing that ever happened to me. You know what I mean? It was just so good. But we see with the transportation, here's an example of the township lines. We had a guy in a wheelchair, so we couldn't take them. He lived on Central, but in Elk Grove Township, and was going 2 blocks into Wheeling Township. And so Wheeling Township wouldn't come in and get him, and Elk Grove, understandably, we have borders just like everybody else has borders. You understand it, but it's so hard. He's like, I'm really willing to go across the street into Wheeling Township, so Wheeling Township would pick me up, but they would. It was just, and we drive so many seniors every single day. I have some drivers that drive 4 or 5 times a week, and we still can't keep up with the demands. And this allows them to age in place because they're staying healthy, and they're going to their medical appointments, and they're maintaining their health. So that leads to all the other things, housing and all that stuff. But it is nonstop for us.
Thank you. Oh, got a couple more over here.
The service providers that have already spoken are absolutely fabulous, and they help us daily in our community get our seniors around. But when their services aren't the appropriate service, I have a lot of seniors who are incontinent. They cannot sit waiting for the bus to come back to get them without making an accident, so they won't use the bus. And top of the wheelchair issue like Dallas is talking about. One of the other ways that transportation occurs is through a private service. Jeanette has an awesome part of her program at Right at Home through Lyft that will take patients to visit their kid or go to the grocery store or go shopping for whatever. But the problem is most of the seniors in our community cannot use a smartphone, and all of those services, GoGo Grandparents, Lyft, Uber, all require the use of a smartphone and paying for lots of different pieces, not just actually owning a smartphone, that seniors just don't have that technological background that we've talked about to be able to use. So if they use a provider like, say, Jeanette's program and GoGo Grandparents, there's a surcharge involved if they don't, if they're not doing that actual service piece themselves. It's not astronomical, but I haven't had a single patient that can afford it, and I promote those programs daily. So we need a way of having an electronic means to order services for those other types of rides, non-medical rides, non-township bus rides, if they can get into a car, because a lot of those services have issues with walkers and wheelchairs, just like Dallas brought up. We need a way for them to be able to order those services. And probably without a surcharge that they can't afford.
Thank you, Jill.
So one thing that I guess a role of my position with Kenneth Young Center is we provide community support. So without divulging details of a client and breaking confidentiality, just generally speaking, I could have a person who's a client who might need therapy services, but also need help like filling out a SNAP benefit form, and then also going to the grocery store. So they're allotted so many hours. And so I could help a client, with transportation and other things, and then some clients might not require as many services because they will take PACE. They like to take the bus. Other people don't. And then other clients, I believe it's through Medicare, you would know, where they get the Medi ride, or they can get, if they call like 72 hours in advance, they can arrange something, and it's paid through, I think, by Medicare. I might be wrong on that, but then they can get that. But I only know a few people who drive. The rest of them do rely, on bus, us, or that medical assistance that they might get through their insurance.
Great, thank you.
I think in general, the transportation is lacking. When you look at whether it's public transportation or just a way for seniors to have accessibility to get to their appointments. I have a lot of conversations talking about their grass, and then you get the life stories. Yeah. And many of them do talk about their ability to drive. And when they lose their ability to drive, then that is the time they need to go into a home, because they almost have this view that is the freedom and the luxury. And once that's gone, then it's almost like time to go to the final resting place.
I'm sorry, just for clarification, this is kind of your comment, not they're telling you this, or
no? I've been told this by seniors that once they lose the ability to drive, the purpose of them living independently in a home by themselves is pretty much over.
Kind of game changer,
right? And so, where we might have public transportation and things like that, it's even getting to the public transportation, right? Maybe the nearest bus stop is 3 blocks away. That can be a long walk when you have a hard time walking. Maybe it does have a wheelchair accessibility, but a senior in a wheelchair wheeling themselves 5 blocks down the street to get on a bus just is not feasible. And I know there's other programs and Ubers and Lyfts and things like that, but they're all costly. Yeah. And they're barely able to afford the home that they're in with their senior tax rate freeze and their Social Security, and that's pretty much it. Maybe a surviving spousal pension, but it's just not simply enough. So the overall transportation system, and it's all, where does it all come from? It all comes from, tax dollars and funding. It's lacking.
Okay, thank you. Any other transportation comments?
I work at Honolulu Family Alliance, where we serve a lot of Korean American older adults who are limited English proficient, and we get calls every day asking us if they can get help with going to a grocery store or going to their doctor's appointment. And today I'm learning there are so many resources out here at Mount Prospect, but the fact that they can't speak English and the fact that we can't refer them to any of these agencies or any resources, because ultimately they're afraid. They're afraid that they won't be able to get adequate services for not being able to speak English. And they feel comfortable, coming to us and asking us, what resources are available for them, what can we do to help them. So we're talking about accessibility, but language accessibility, I think, is a big issue that we need to cover. And I would like to see a little more representation of, culturally diverse kind of population in Mount Prospect.
Point well taken. Very good. Thank you. So I wanted to I said transportation. I was going to break into 2 questions. The second one is I want to ask about non-vehicular transportation. So using non-vehicular transportation modes for those who can or choose to do so. And I'm talking about walking, I'm talking about wheelchairs, assistive devices, bicycles, scooters. What's the adequacy of Mount Prospect for the folks using non-vehicular modes of transportation? Is it good overall? Is it some good, some bad? Are there neighborhoods, areas that are particularly, supportive of non-vehicular transportation modes as opposed to areas that are, not supportive? What are your thoughts? Again, start with the second feedback comment.
Hi, I just want to preface my statement by saying that I'm a planner by training as well, so I made it up to administration. But the challenges that I think we have with non-vehicular transportation in Mount Prospect particularly are the places that people want to go revolve routes in which we do not control the roadways. So I'm talking about IDOT, and IDOT is not very cooperative. I'll just make it as simple as I can, with allowing us to improve it for pedestrian access, for bicycle access. It's not a high priority for them. And every road that you drive down to get here is probably an IDOT roadway. So to get to Ranters, to get to a grocery store, to get to Village Hall, to get to the Community Connection Center, those are all roadways we do not control. So that's one of our largest challenges. It affects everyone, not just the older adults. And it affects people who do not have a car because they cannot afford a car or they choose not to have a car. And we're working really hard to try to make that happen, but that's one of our larger challenges that I don't think you'll see you'll see it in the suburbs closer to the city, but as you get into other towns, it's not as prevalent.
Great. Thank you, Nellie, both for the comment, for proving my assumption that once a planner, always a planner.
I'd just like to commend the village for really what I've seen in the last 3 years with a lot of infrastructure or sidewalk improvement at the intersections. They have ramped pretty much all 4 of the corners. I know that's a big lift and that's an ongoing project, but I do think that minimal improvement does help the older set get around their neighborhoods simply just for exercise or whatever else. So that's been a great thing to see.
Right. Thank you.
Just real quick for factual context, there are 21 neighborhood parks in Mount Prospect and miles and miles and miles of walking path, and it is always a priority that when we go to work on park repair, the first thing that's repaired is asphalt path paving. So I do know a little bit about my counterparts. 21 parks is a lot. They are nicely situated in residential neighborhoods. And in one positive note, I do think they're well used and regularly used by seniors.
Right. And thank you for kind of broadening the discussion of non-vehicular transportation to talk about public spaces, parks, plazas, sidewalks, town square sorts of things, adequacy, location, upkeep. Comment on that?
I'm not certain why, but there are a lot of streets that don't have sidewalks at all. And then as a driver, you encounter these people walking on the streets, which is not safe. I don't know if it's unincorporated areas, but there's a part on Rand Road just south of Kensington. And my daughter said, I'll meet you 2 blocks down. And then she calls me back and she said, I can't go because I'd have to walk in the street on Rand Road. And sometimes it's in the neighborhoods too. So it just depends. So people who, they can't get to the park if they can't walk safely and stay out of the streets.
Thank you. That's very good insight.
What I wanted to say before was, in regard to IDOT, I live in West Dundee, and we have the issue of the traffic moving so fast. The speed limit is 25 miles an hour, and the cars literally go 70. And so that's really dangerous for everyone, but especially for an aging community. And when we talk to IDOT about that, their whole goal is to move traffic. So as she was saying in planning, how do you overcome that?
Hold on. if someone was responding, I do want to get them the mic, but go ahead.
Well, I was going to speak to the new sidewalk program through Public Works. I know that engineers constantly try to find subdivisions that need sidewalks, so that is a program that we work on. And the engineers at Public Works are also working on an ADA plan for the village.
Great.
So it's something that Public Works definitely thinks about and works on.
Great. Thank you.
That I don't know. I'm unincorporated. Oh, no.
Two things for your comment. Rand Road is an IDOT road. So again, that will be correct. So just so we're clear, the IDOT, when I talk about sidewalks in general, public sidewalks are part of the public right-of-way. So that includes the roadway, the grass, the grass that's kind of between the roadway and the sidewalk itself. So all of that is part of the public right-of-way, and hence why the village will go around the neighborhoods and actually repair those sidewalks. But for certain additional sidewalks, like along Rand Road, especially in unincorporated areas where we don't have any type of control, it would be an IDOT project, or it would be a township project, whatever township that particular unincorporated area is in. It's very difficult to get those sidewalks put in because they're expensive. They're just not a high priority for them. Like, you mentioned, it's about the traffic. It's about moving cars as fast as we can through the area. And another additional, not to keep going about this, but another additional pedestrian challenge in our area is rail crossings. They are very difficult to cross. They will, Union Pacific and the other railways do not really want pedestrians crossing them, if at all possible. So your only other options are really expensive bridges, essentially, to cross. So you're going to have those major barriers to pedestrian access being large roadways like Rand Road and Northwest Highway and 83, and on top of that, the rail crossings. So it's very difficult to walk, bike, longer distances anywhere. Even if it's, I want to go across, is a senior going to be comfortable crossing 83 just to get to Central Continental Bakery, even if they live across the street? Probably not. And we've talked about that at length. We've literally brought IDOT representatives to the corner to say, look at this problem. And they say, we don't see it. We don't see a problem. Because the traffic is moving.
Thank you, Nellie. Well, folks, I see that by the clock, we're getting very close to the promised closure time of 11. I think we started a marvelous conversation today. Never in my wildest dreams did I fool myself into thinking we're going to finish the conversation today. But if I may, I just want to, does anybody have any short, succinct kind of closing comment or key takeaway they wanted to share with the group? And that's open invitation to anyone.
Sorry, not trying to manipulate this, and this has been a great discussion, but I want to get this point somewhere, and it's the whole construct of ageism, and again, I go back to kind of the generational divide on this. We at the center have done some intergenerational programming, which I think has been outstanding, and I also kind of reference my own, I'm going to say childhood, and just being aware of my neighbors or the older people in my community, cutting grass, shoveling snow, raking leaves, things of that nature. That is really a miss these days. I speak to that because I have an elderly neighbor across the street who doesn't even talk to either of her next door neighbors for whatever reason, I don't know, but is constantly looking for somebody to take their hose in or take their hose out or help with a garbage can, and we don't know where to go. So if there's some byproduct of this to be like a neighborly awareness campaign to break down, again, some of the generational divide, I certainly hope that somewhere along the way comes up for consideration.
You've put it on the table very articulately. Thanks to other thoughts, last kind of takeaways, closing comments. Well, Ginny's got one. By the way, as she's bringing the microphone over to Ginny, how about a round of applause for Cheryl for putting about 6 miles on her shoes?
I was the one that was emailing all of you incessantly, so thank you for, attending and being so good about responding and getting your assessments to us, because we really need them. And I just want everyone in this room to know that you were handpicked, literally from a very small group, to attend this. So all of you are VIPs to the Mount Prospect community, and we're going to need you as we go forward with this initiative, and we really, really appreciate the time. And I know the residents, though I can only speak for my parents who live in Mount Prospect, but I know that, the seniors really, really want to know that, people still care about them. And we're all going to be them one day. So just thanks for coming. And as I said, I appreciate you guys all being here.
Thank you, Jim. Oh, I got, Sean has a closing comment or observation.
So this was a great discussion, and I guess we focused a lot on housing and transportation, which are critical needs for this population. But there were a number of other topics, right? Places to gather, goods and services, just connectivity in general, that we didn't have a chance to do. I just don't want to short shrift some of the other topics, because I know, just looking at workshop 2, it seems that we're pivoting a bit towards the survey results and kind of the so what of it all. But I just worry that those are also meaty topics that kind of need to be discussed as well.
Yeah. Good point, good admonition. I'm not involved with the task force. Knowing a little bit about the protocol that the task force is part of, they're really looking at, and the World Health Organization, AARP, age-friendly protocol identifies 8 different domains, and so they touch issues that include but go well beyond the housing and transportation that are kind of everybody's first response topic. But point well taken, and the good news is those conversations carry on with this ongoing task force, and you get to hold their feet to the fire. So it's 11 o'clock. I try to plant the landing. I want to thank you all for not only just being here, that's the easy part, but being engaged and offering really thoughtful, critical observations. Because my parents raised me well, I also want to specifically thank Julie and Jill and Ginny, Antonia, Valeria, and Howard, who's behind the glass filming all of this. So everybody wave to the cameras. I don't know which one's live now. But thank you all for being here. The conversation continues. The second workshop, which is open to, broad, anybody can come, is Wednesday, December 1st, and information will be posted and made available through the community. But with that, it's now 11:01. I almost planted the landing. Thank you very much, and have a good, safe afternoon.